Check it out, everybody. This is Phil from New York Rocks. We're down here at the Capitol in Washington, D.C., and we're here with Scott. Scott was a police officer and also a first responder. How you doing, Scott?
Hi, good to be here.
All right, cool. All right, so let's talk about your experience with what happened on 9/11 and today. Why are you here today? Go ahead.
Well, I was a 9/11 first responder, and I also did 300 hours down at the pile. I also worked in that area from 98 to 2005. And
You're retired now, right?
I'm retired. I was actually forced to retire. I started becoming sick, and that's when they forced me to retire. And it's been a slow battle ever since. I mean, battling the medical board level, then the court level, then the city. Now we're battling the government, Congress. And it's been 14 years of struggle, basically.
That seems to be the problem with most of the first responders now. You know,
yeah.
they forgot.
Yeah, they have forgotten, and it's embarrassing that we have to constantly come back and remind them of what's going on, the struggle that we have. We're losing doctors now from the program. It's imploding basically since it expired in October, and it's dying a slow death now. And we're trying to implore that to them to please fund this bill before December 11th. That's the deadline that we have.
So why do you think that we have to keep coming back here and be fighting for this? Why is it that they keep reauthorizing the bill?
It comes down to just basically a Congress that's detached, has forgotten about 9/11. And it comes down to money too. I mean, money's the bottom line for these people. Even though we have a sound pay for, even though the bill has been through numerous committees, there's no fraud whatsoever. It's sound. It's been handled perfect. I mean, if Congress have done anything correctly in the last 5 years, it's been this program. And to let it die like this, it's a black eye on America. It's a dark day for America.
Now these guys need the coverage, because if they don't get the coverage and the medical treatment, and it's costing thousands of dollars for this cancer treatment.
Yeah, tens, hundreds. I mean, the co-pays alone would bankrupt you if you're going through cancer treatment. The medications as well, you know, and even though some people have insurance, you have people that have no insurance whatsoever, like volunteers, and they're just screwed completely and need this program to live, basically. And anybody that is a part of this program needs it to live, because financially nobody can afford this, and basically people will die. And myself, I live in Pennsylvania now, and I can literally walk across the street to a hospital and receive treatment, monitoring, medications, rather than having to drive back to New York, which won't happen, because financially I just can't afford it.
And as people get sicker, how are they going to transport and be able to withstand that? You know?
Yeah, they just don't see it that way. You know, they think it's a New York problem, or a Pennsylvania problem, or a Northeast problem. But basically, out of every congressional district, only 2 didn't respond on 9/11. Everybody else responded across the country. So it's an American problem. It's an American issue, and we constantly have to remind these people. You're talking to 20-year-old staff members who were young at that time, have no recollection of it. You know, cannot empathize with us. So we got to come back here and constantly remind them of what's going on.
We shouldn't have to, though.
We shouldn't have to. It's a travesty. It really is. It's an insult. I mean, earlier today we were in a congressional office from Texas, and the staff member says, "Can you have people in our district who are part of your program contact us?" I mean, why? Why do we need to go there? You have the information. You have the data. Why do we need to do that? Insult. Total insult, embarrassment.
Well, that's why you're here,
Yep.
You know. And what advice would you give to the people out there in Congress and other first responders? What should they do to help, battle this with you guys? It's a battle. You know?
Just basically put your ideologies aside. Stop thinking about the bottom dollar. This is not a tax on Americans. Our pay for the program is not a tax on Americans. It won't affect Americans in any way, but help people who are American, who risk their lives for this country, get involved. And it's not just a 9/11 issue, it's an American issue in general. If you can't take care of your own people, then what good are you? What good are you, you know? It's sad.
I want to thank you very much for speaking with me, and best of luck with this, and this definitely needs to be passed. This Zadroga bill.
Thank you. I really appreciate your time. Thank you so much.
All right, thank you.